a lot of veterans don't realize that they have this benefit of caregiving that they can tap into.
Hello, everybody. This is Sherri back with Operation Successful Transition, and today our special guest is Jennifer.Lewis. She is the owner of BrightStar Care, the facility in Bryan-College Station. I'm just going to let her tell you about what she does, what her company does, and who she serves. So tell us a little bit about you and what y'all do.
Hi there. Yes, we are a home care agency. We take care of people who are sometimes recovering from surgery, sometimes recovering from cancer treatments, and they are deconditioned. Sometimes it's people who have just reached a stage in their aging progression where they just need some help. They need help with taking a shower. They need help getting out of bed in the morning, taking care of making meals and setting them up for success. And I strongly believe in helping people age with dignity in their home or in the place they've decided to call home. So we also take care of people when they're in assisted living facilities, but also need a little extra help in order, again, to live their life in a dignified manner.
Right. But we know that your health can either be a slow progression downhill or your aging process, or it could change in an instant. Some event could happen, an accident or a stroke or something like that. So it's good to have an idea of what's available in the community to you, and in case something happens. Yeah.
Absolutely. And we've had some wonderful success stories where one stands out in particular. She'd been in the hospital with cancer and treatments and had been in bed for a month. And so her muscles had atrophied so much, and she had deconditioned so much that she could hardly lift her head off the pillow to take a drink of water. And so our team came in and we were with her, and her husband was there, but he needed the help, the extra help. And so we were there around the clock, helping her, bringing her water. We had therapists in there to help her regain her strength and her mobility. But gradually, over the course of 4 months, she regained her strength. She was we were helping her get into her wheelchair. We were helping her get into the shower, take her first shower that she'd had in 2 months, if you can believe it. And gradually over that period of time, she regained her independence and no longer needed us. Her goal was to be able to go back to shopping on her own, to be able to go to TJ Maxx and walk down the aisle by herself. And she accomplished that. So it's not always about ushering people toward death. A lot of times we're in there just to support them moving forward. And
back to retail therapy.
Exactly.
That's fun.
And that was a wonderful, of course we worked ourselves out of a job, but that's great.
That's all right.
Yeah. The name of our LLC is Optima Vitae, which is Latin for best life. So the goal is just wherever you are in your journey, we want to come beside you and help you continue to live your best life.
Yeah. So like people like me, I live by myself and I wouldn't have someone around to help. So I could see where that would be useful for someone like me. And
absolutely.
Like you say, sometimes the spouse they do the best they can, but they can't manage everything and they need a little extra help. So
absolutely. And, we're professionals. So our field staff, this is what they do. This is their passion. So, I believe firmly in allowing the spouse or the child or sibling or whoever it is who's the primary caregiver to continue that relationship with the person who needs help. And so we can come in and again, it's about dignity. If they need help taking a shower, sometimes it's better to let somebody who does this all the time, every day, and that's their chosen profession, to do that and let the spouse or the child, the daughter, whatever, continue to be in their preferred role.
Right. Yeah, sure. And if the family is particularly modest or something like that, that still preserves that and doesn't get into a weird space with that.
Exactly.
Do you do medical things? Is this
We do. We
like
do.
providing medicine and other things like that?
Absolutely. And we have two kind of separate licenses. One's for providing nursing and therapies. So we do that with certain insurances and the VA veterans. But then we also do what's called personal and companion care, and that's more of the they're called activities of daily living. So helping you just kind of live your life. And so we do both areas of in-home care, which is a unique um, business model that we have in the area. Most of the home care companies either do like Medicare, home health, or and maybe hospice, or the personal and companion care. So we're able to. The nice thing is sometimes we get a referral for somebody who's coming out of the hospital and they need physical therapy, for instance. But then we can offer the personal and companion care, because if they're having a hard time, they've had a knee replacement, for instance, and our physical therapists can identify, you actually need help getting your meals to you while you're recovering. And maybe it's a short-term assistance, but it's nice to be able to work with one company and not have to hire two different companies for those needs while you're recovering.
Right. With less complicated, less stuff to arrange, yeah.
Exactly.
Yeah, I wondered
We do
about
the
that because,
coordinating.
yeah, the ones that I have heard about are one thing or the other. So it's kind of, you have to hire two people where you guys do both things.
Yeah.
What inspired you to get into doing this business? What light bulb went off that made you want to do this?
Well, I am a speech pathologist. That's my background, my profession. And I have mostly worked in hospitals throughout my career, but I had done some home health early in my career. And I always liked the idea of being in the home. People are most comfortable in their home, and that's where they live their lives most of the time. So being able to support somebody in their home and the reality of what their daily life looks like is very satisfying, as opposed to being in a facility or outpatient situation. And I was working in a hospital when we first had the shutdown during COVID.
Yeah.
And it was devastating in that for families, in that they were not allowed, for the beginning of the shutdown, they were not allowed to come in and visit. And I was working in the neonatal ICU at the time. And maybe one parent at a time could come for a very short visit. Well, that's just heartbreaking, obviously. And
Right. Yeah.
COVID, I think, caused a lot of people to look hard at what they're doing and what the future is going to look like. And at the beginning, they were predicting that it would be about 3 years, comparing it to the Spanish flu. And it was about 3 years of us, having to really tiptoe around the pandemic. And I just thought, you know what? I think this is going to continue. We're going to continue to have these spikes in pandemics or crises like that. And that I was just kind of predicting that the future of healthcare was going to move more toward in-home care. And it really is. We're seeing that there's going to be more and more, well, we're already seeing it more quickly being discharged from the hospital. And also
Right.
that people just don't want to be in facilities. They want to avoid being in the, kind of the classic nursing home situation. That's where, the pandemic spread the most quickly, where it was in nursing homes. And so I'm not saying nobody should go to a nursing home. Sometimes that is the most appropriate place. But if I can provide more elevated care in the comfort of your home and allow you to stay in your home, I mean, that's an honor. And,
Yeah.
and then moving here, we moved here from San Antonio to be closer to family, and realized I wanted to make sure we were here forever. This is where we want to retire and live out the rest of our lives. That I wanted to make sure something was in place for me and my family as well.
Yeah. So
Yeah.
what a great thing. And I agree too that healing I heal better at home myself. It's uncomfortable in a hospital, sleeping on a rubber mattress and having people wake you up all night, and just the
Exactly.
noise and the smells, and the food's different, and just the whole experience. It's like just not as comfortable. So if you can be at home and have someone come in, that's amazing. Would be just a great bonus, and be able to do that. And
Right.
this is boomers are all getting older, and
Right.
even Gen X is getting to that age too, where some of us are going to need some care. So I think it's timely, and Bryan-College Station has a lot of retirees, so I think
Right.
we need to
Oh,
get the word out about you. Yes, that's
it's
good.
a wonderful place to retire. I think, and we take care of the outer areas as well. The larger Brazos Valley, and that's a lot of the people who, veterans and um, people, moving from Houston and Austin, San Antonio, Dallas to live in a kind of quieter, more pastoral
Yeah,
community. And so I'm committed to that too, and to hiring staff who live in those communities as well, so that there's this real sense of taking care of one another, um, and it making it feel more like family.
right.
Those.
So your husband is a veteran, yes?
Yes, my
Yeah.
husband, my
So
father-in-law was a veteran. My son-in-law is now a veteran. He's just recently transitioned out of the Air Force. So yes, veterans are very much an area that we feel very passionate about, supporting that group. I know firsthand the sacrifice that goes into serving in the armed forces, and I feel like a lot of veterans don't realize that they have this benefit of caregiving that they can tap into. And there's, every veteran that I recognize and say, thank you for your service, they 100% of the time say, thank you, it was an honor, I would do it again, 100 times. And they're so humble and will not ask for help, but it's a service that the VA will pay for and they deserve to tap into.
yeah,
And their family members, so there are respite programs for veterans family members. So,
the
when,
caretaker. Yeah.
yeah, yeah, yeah,
If that's something that you've earned by your service. It's
exactly.
not something that says you're a burden, or not going to put some burden on you that, oh, you're handicapped or whatever.
Right.
There's a stigma that some people feel, and they don't want to go for their disability benefits. They don't want to be called and labeled disabled, but that's not what this is. This is help for you when you need it. Sometimes we have surgery, sometimes we have events, and we just need a little extra help. So
Well, and especially veterans who live alone. I mean, part of what we offer is companionship, companion care. And so just coming in, sharing a meal, having a conversation, that is so impactful for your mental health, if nothing else. And continuing, and I'm passionate, as you know, about um, mitigating the depression and the potential for suicide in veterans. So that companionship goes a long way um, for decreasing the risk of depression
yeah, yeah,
that we can all, experience. I mean, that's not just about aging, that's just in general.
right, yeah. So so we talked before, and you were saying that is there some type of insurance that you don't work with? Am I remembering wrong?
No, we are not a Medicare home health
Okay,
agency,
yeah, that's it.
but however, there's a new program that we are have just launched and I guess adopted, which is called Guide, and it is a pilot that Medicare has rolled out, and I think it's for 5 years. They're going to test it, but it is for people with cognitive decline, so dementia or other cognitive complications, and it allows for a $2,500 a year of caregiving. So it will be paid for by CMS, by Medicare. The person to qualify for it has to have straight Medicare, not Medicare Advantage, straight Medicare, and a diagnosis of early or, well, any stage of dementia. And the rationale for it and what they're testing is to see if the care, and it's kind of a respite type program. So it's to give their family caregiver a break, so because they get worn out and easily burned out. So and they're trying to determine if this will decrease readmissions to the hospital, because statistically, people with dementia are more high frequency admissions to the hospital, just for other medical comorbidities. But so they're hoping that if they have more support at home, they'll be less likely to return to the hospital, which of course is more expensive for Medicare.
Right. Yeah.
So it's really an exciting program, especially if used just sporadically, to give their primary caregiver a break. Maybe they need to go to doctor's appointments of their own, or they just need to get out of the house. And
right. Yeah. Oftentimes the caregiver dies first because it's so stressful and it's so taxing.
Exactly.
People don't grow up and don't necessarily have the training on how to deal with someone with dementia. It's like,
Right.
This is personal to me. And then our person with dementia is very busy all the time. You have to watch all the time so they don't get hurt, so they don't get lost, so they don't, lock you out, so they don't, hide things, lose things, whatever hurts
exactly. And everybody doesn't have the patience that you have, Sherri. So, I mean, the risk of neglect and of abuse of the person with dementia is higher, because
didn't think about that, but
because if I, as the primary caregiver, lose my patience and I just don't want to deal with them anymore, well, that's a type of neglect. Or if I lash out, that's abuse. And it's just, it's a risky population. And I'm proud of the post-acute community in the area, that we're working really hard to work together and create a dementia-friendly environment where we're increasing education of the public. And it's exciting to see, the collaboration among the senior living community.
Right. Yeah. I mean, we are all a community, and you find as you get into these different areas that, everybody knows everybody, and they know kind of the best place for you. And there are a couple of different memory care places in town if you're going to be residing there, and they have different feels and different flavors. And
right.
We have a friend that we can hook you up with to help get you placed in something like that. But before you go there, this is what Jennifer is great for. So is there, how can we bless your business, or is there anything we can do to help you get with your business, to get the word out or anything like that? What can we do?
Oh, yeah. This is great. Just having conversations, and I love meeting people. And starting this business has been, I mean, I was excited about it, but it has been an amazing adventure so far. And I just am excited to see, to meet more people and make more connections. And
so if you do like a consultation, if someone thinks they may need some help, you'll come out and talk to them and let them know about all the things that are available to them, that kind of thing.
Exactly. Usually people call, and then I arrange a visit in the home, and like to see the space where the whoever we're caring for lives, and make suggestions sometimes about, making it more safe for them. Sometimes they need to remove some rugs, or put some grab bars in the bathroom, things like that.
Yeah.
And try really just to be a resource. A lot of times people at the beginning, they just really have no idea what they want. They know they need something in place, but they don't really know, what the possibilities are.
Right.
And sometimes, the family member who's asking for the help is just needing some encouragement too, because they feel inadequate. And a lot of times it's like, actually, you're doing great, but we're here to come along beside you and help you have some relief and some confidence. So we really, I have a great administrative team, and we really all feel passionately about partnering with families and keeping in touch with them and reaching out and saying, how are things going? What can we do? Do you need more? Do you need less? And there's nothing is prepackaged. It's all, custom to whatever the need is.
Yeah. What a great service you provide.
Thank you.
So we're going to put, excuse me, we're going to put all the contact information for your agency in the description. So people will be able to just click on the links, and we'll have all the ways to contact Jennifer in the description as well. So if you or a loved one needs some home health care, even into the medical side of things and the respite side, that's such an exciting thing to know that government agencies are caring about the caretakers and giving them this respite. That's really
Right.
very important, I think. But thanks for sharing that with us. And that's an exciting development. So hopefully that beta will work out well and they'll continue it and increase it, the amount even. That'd be nice.
Right.
So is there anything that I've forgotten to ask you? Is there anything else that we need to share with everyone?
No, I think that's, I hate to, and like it could go down a lot of rabbit trails. So
Yeah, so many stories. Jennifer and I've had lunch before, and it just one thing leads to another. Stories after stories, interesting character after interesting character. Of course, protecting everyone's anonymity, of course, since keeping it professional. But there's so many interesting people out here in the world, and it was a fun lunch. So, all right. Well, thanks for coming
thank you so
today. I
much.
appreciate you.
Thank you. I appreciate you. It's fun.